Welcome. My name is Anna and I'm one of the providers here. In this video, our excellent nurses will guide you through some of the recommendations that we have for your pregnancy.
On behalf of our triage nursing team, we'd like to welcome you to our practice. This video will go over the things you need to know before you come in for your first appointment. We're going to talk about some of the do's and don'ts of pregnancy and what to expect with your OB care here.
Our phone number here is 206-386-3400, and that is from Monday through Friday, 8 a.m. to 5 p.m., but it's also the same number you would call for scheduling and after-hour concerns as well. We also have a patient portal through myhealthrecord.com, which is a great way to get in touch with non-urgent questions, because sometimes we don't see those for like 2 to 3 days for a response. So if you are looking for something that's urgent, we really recommend that you call. For your prenatal care, in keeping with the guidelines set by the American College of Obstetrics and Gynecology, we recommend routine monthly visits until 28 weeks, every 2 to 3 weeks until you hit 36 weeks, and then weekly until you deliver. And your provider may recommend additional monitoring in the third trimester if needed for your pregnancy. Regular prenatal appointments are a chance for your care team to both assess and educate. Time is taken during every visit to answer questions, review labs, and physical findings, and may help you prepare for childbirth. Many women also take childbirth education classes during their pregnancy. For nutrition, if you're not already taking a daily prenatal vitamin, we do recommend that you start, and you need to have at least 400 to 800 micrograms of folic acid. Eating a variety of good foods each day is the best way to make sure both you and your baby are getting all the nutrients that you need. Most pregnant women need between 1,800 to 2,000 calories per day, and daily recommendations would include 3 servings of protein daily, calcium 1,200 to 1,500 milligrams a day from either food or supplements, and 4 servings of fruits and vegetables each day. We do screen for iron deficiency in pregnancy and will recommend additional iron as needed. Hydration is really important during pregnancy and postpartum, so drinking 2 liters per day might help with swelling, constipation, and even preterm contractions. Visit our website for more additional information about nutrition and during pregnancy as well. We do worry about foodborne illness during pregnancy, so to protect your baby from foodborne illness, we want you to avoid some undercooked or raw meat and seafood, raw eggs, and unpasteurized dairy products. Also avoiding eating fish with high mercury levels such as shark, swordfish, king mackerel, tilefish, marlin, and tuna steak. We do recommend avoiding sushi and cold smoked fish as well. To protect you and your baby from listeria, a harmful bacteria that can be found in foods, take these steps. Wash your hands often with soap and water. Keep raw meat, fish, poultry away from other food that will not be cooked. And cook food that is safe to a safe minimum internal temperature. And do not eat or drink unpasteurized dairy products or soft cheeses. Wash your fruits and vegetables prior to eating. Those are always good steps to do if you can. So medications in pregnancy are best kept to a minimum. While some are considered relatively safe, many are not or are lacking data to support safety in pregnancy. Medicinal herbs and natural remedies are not regulated by the state or federal laws and should be avoided. Our website contains a list of over-the-counter medication which are safe to use during pregnancy. And if you are on a prescription medication and have questions about whether they are safe to continue, please call our office. Caffeine intake should be limited to no more than 200 milligrams a day. Avoid alcohol, smoking, vaping, and recreational drug use. Please feel free to talk with us privately about any concerns related to drug use so we can give you the best advice for your healthy pregnancy.
Common symptoms of pregnancy. Nausea and vomiting. Feeling nauseous during the first 3 months of pregnancy is very common. It usually improves by 14 weeks of pregnancy. In the meantime, try to eat 5 to 6 smaller meals a day in order to keep your blood sugar stable. Nausea tends to worsen when your stomach is too empty or too full. Try bland foods like plain crackers, toast, dry cereal, as well as carbonated drinks. Prepackaged ginger and peppermint teas are natural treatments that can help as well. First-line medication for nausea management is vitamin B6. 25 milligram tablet 3 to 4 times a day, and doxalamine, Unisom, 25 milligrams at night. This combination helps with both nausea and sleep. Call our office if you are unable to manage your nausea or vomiting. Cramping. Experiencing some cramps is normal. When they occur, empty your bladder, drink a glass of water, and try to rest. If your cramps are only on one side and more than mild, please contact our office to speak with a nurse. Spotting. Light spotting can be common, especially in the first 12 weeks of pregnancy. It may occur after intercourse, vaginal ultrasounds, strenuous activity, or exercise. If the bleeding is heavy or accompanied by pain, contact our office immediately. Activity limitations and modifications. Exercise in pregnancy is highly recommended, ideally 30 minutes 5 times a week. It's safe and normal for your heart rate to increase. It is important to keep a pace where you can keep a conversation going and stay hydrated. Many exercises are safe, however, this is not the time to start a brand new vigorous program. Let your body set its own limits. Start out slow. If you are tired, become short of breath, or dizzy, slow down. If it hurts, do not do it. Some activities are never safe during pregnancy. For example, hot yoga and scuba diving. After the first trimester, it is also important to not do any activities where you could fall or have a possible contact injury. We are happy to discuss your specific exercise questions during your prenatal care appointments as needed. Hot tubs and saunas are not safe during pregnancy, especially in the first trimester. This is due to increased risk for miscarriage and neural tube defects. You can take a tub bath during your pregnancy with warm water if you keep the temperature at or below 100 degrees Fahrenheit. Dental care is safe and recommended to continue during pregnancy. You can have local anesthesia should you need a repair, but no laughing gas or x-rays without shielding. Many patients wonder if their favorite services and treatments are safe. It's safe to use or receive hair coloring or highlighting, massage, except abdominal massage, nail care, waxing or electrolysis, facials, and many over-the-counter acne treatments. Avoid Retin-A or retinols, salicylic acid, tanning beds, spray tan, laser treatments, or teeth bleaching.
Travel. Travel can be safe until 32 to 36 weeks of pregnancy. Most women can travel up to 20 weeks without concern, but sometimes complications can arise where travel is not recommended. We may revise travel guidelines based on your ultrasound results at 20 weeks. It's always wise to book refundable reservations or have trip insurance. Remember to wear your seatbelt across your lap and below your abdomen as your belly grows. Plan to get up to stretch every 2 hours and walk to improve circulation in your legs. You may also wear knee-high compression socks to reduce swelling and prevent blood clots. These are easily found in pharmacies or online. If you have questions about your planned travel, please discuss these with your provider. Environmental exposures and toxins. Toxoplasmosis is a disease that can be serious if contracted during pregnancy. Fortunately, it's uncommon in the Pacific Northwest. To minimize the risk, avoid changing litter boxes while you're pregnant. In addition, wear gloves and a face mask when handling outdoor materials that potentially are contaminated with cat feces, things like garden soil, lawns, and sandboxes. Thoroughly wash your hands afterwards. When to call the provider. If you experience any of the following, please contact us immediately, as these are considered emergent. Continuous leaking of fluid, or you think your water's broken, abdominal trauma, a fall, or a car accident, heavy bleeding, or any bleeding that you're concerned about, fever greater than 101 degrees Fahrenheit, decreased fetal movement after 24 weeks, or symptoms of urinary tract infection, or if you're experiencing painful contractions greater than 6 times in an hour, diarrhea lasting more than 3 days. If ever in doubt, please do not hesitate to call. This information, along with more details regarding healthy pregnancy, can be found on our website. Please also review the video on genetic screening prior to your new OB appointment.
Don't worry, we know we gave you a lot of information in these videos. We'll use your upcoming visit to review some of this information, as well as answer any questions that you may have.